Essential information for healthcare providers on pregnant and breastfeeding agricultural workers and pesticides. Contact with certain pesticides during pregnancy can cause miscarriages, preterm births, low birth weight, birth defects, and adverse neurodevelopmental outcomes. Some pesticide residues may be found in breast milk, and adverse health effects could also happen to breastfed infants. Long-term exposure to even small amounts of pesticides during pregnancy and breastfeeding may lead to health effects for the baby that can occur long after birth and breastfeeding. Agricultural workers who are pregnant or planning to become pregnant should be informed of possible impacts of exposure before, during, and after pregnancy when breastfeeding. Ask your patients about their occupation and, if they are agricultural workers, these are some ways in which you can help them reduce their risk during pregnancy. Recommend that those who are pregnant or planning to become pregnant avoid exposure to pesticides, especially during the first trimester. Suggest actions they can take to reduce their exposure to pesticides and their family's exposure. These may include carefully reading pesticide product labels before use, wearing any required personal protective equipment and ensuring it fits properly, not entering a treated field until permitted, washing their work clothes separately, and leaving work shoes outside of the house. Inform your patients about their rights. Regardless of their immigration status, female agricultural workers may be entitled to job-protected time off work and wage replacement during pregnancy, as early as a positive pregnancy test, and even after childbirth. You can file for protections such as California State Disability Insurance on behalf of your patient. California employers are required by law to provide reasonable accommodations for pregnant employees. For pregnant agricultural worker patients who need to continue working and can do it safely, you can recommend reasonable accommodations such as modifications of work practices, duties, or schedules to limit their pesticide exposure. To do this, you can write a note to your patient's employer so they can safely continue working during and after pregnancy. An effective note should state your patient's condition, identify and provide expected duration of their limitations, and specify the recommended accommodations. If you need assistance enhancing communication between you and your patient and getting support to advocate for your patient's protection, consider working with community health workers. It is important to remain updated on ways to diagnose and treat overexposed patients. And be aware that California state law requires physicians to report known or suspected pesticide illnesses. If you would like more details or if you have any questions, please contact OEHA using the following information: www.oehha.ca.gov/pesticides, or by phone at 510-622-3170, or by email at pesticides@oehha.ca.gov.